Just for the agenda, we're going to review some of the code language here, and we're going to look at what you might need in your organization's policy around how you're going to perform those unable to locate assets. How do you write that up? We're going to talk a little bit about your asset inventory, how to manage that when you're unable to find things, some strategies around those things as well. And then just talk about go through the summary of a checklist. We say Q&A at the end, but if you have any questions during this, feel free to raise your hand or just blurt and we would like to take questions as we're going and start like a discussion if possible. Just introduce myself. I'm Joe at CMS at Management Ones. I hate to say this, but 30 years of healthcare CMMS experience. It doesn't seem like that long, but
issues that we all face. But my job here is really to make your lives easier. That's what I strive to do every day. So please, as he said, ask questions along the way if you have questions as we go through some of this stuff. So.
Yeah, her background's in lighting, so this is driving her nuts.
This is driving me crazy.
This is driving her crazy, so I'll just say that. So.
All right, so the first thing we're going to do is go through a little bit of code language. I'm sure you guys are all familiar with the codes that you need to know as you're going through your inspections. What we want to talk about a little bit here is what do the requirements state, and just as importantly, what do they not state? Because it's kind of vague. As you read through all of the code language, and we're going to go through it here specifically, you'll see there's a lot of things that are not indicated as to what you should be doing. So a lot of that is really up to your organization and your policy. So it's really important to have a policy. So we're going to talk a little bit about how to make that a policy. All right, so choose your poison. So I guess, we all have to drink the poison in order to get our certifications. So a little bit of quick, some dates here. Joint Commission was established in 1951, so almost 75 years they've been in place, helping facilities get through their compliance. HFAP was established in 1965, and I don't know the year exactly, but they switched to ACHC. Not sure what you guys are using here, but DNV is a fairly new entry to the game here. So we have worked with some people who use DNV, and it's the same but different. There's definitely some differences there. So many of you probably don't get to choose who your regulating body is. If you do, that's great. You can establish which one works the best for you and what the policies and requirements are, and how that fits with your own. But what you really should know is whatever regulation or whatever regulating body you're using, you need to know the codes that you're trying to operate against, because when they're on site and they are inspecting you, you need to be able to question really well. So the next thing we're going to talk about, so we're going to ask you accreditation. Are you Joint Commission?
It's always the most.
It's always the most. Okay.
I've not heard of that one.
Okay. And then there's some other things to keep in mind. And CAP. Okay.
Okay.
Whatever your other is. Okay. Okay. Great information. So we've got a code here for some of the things that we're talking about. So for Joint Commission, ECO 20403 is the one that is regarding our maintenance of medical equipment. So that's the one that you guys need to be really super familiar with. That's the one we're going to talk about here today. DNV's is similar, but it's PE7, and that one has to do with the same, medical equipment management. Anybody familiar with CIHQ? They're very new to the game. Okay, so they also have a standard there that's worded a little differently. I mean, at the end of the day, they're all trying to achieve the same kinds of things, but it's really important to know what your language specifically states, because that's what you're going to be judged against. The other thing to keep in mind is that there are other authorities having jurisdiction, AHJ. So there may be some state or local jurisdictions that have some kind of regulation over you as well. So be familiar with those too, and that might be in addition to your Joint Commission or your DNV standards. So we're going to talk specifically about Joint Commission. So ECO 20401 is just stating that the hospital has a policy. Like, that's really what this comes down to, and that they're managing their medical equipment risks. So it's really important to have a risk strategy. Make sure that that's documented. I think the word that we're going to keep saying over and over here is make sure you document. Make sure you document. That's going to be the most important thing to help you through. So for hospitals that don't use Joint Commission accreditation for deemed status, so you're not getting your, not all hospitals can do this, but if you're getting anything from CMS, from the Center for Medicaid, Medicare, you're a deemed status. So your rules are a little bit different there with Joint Commission. That being said, if you read the language, it's really not that different.
We're not going to read it.
Yeah. So I'm not going to read all this. I don't know you guys if you can read it where you are, but the big thing here, which we've highlighted, is whether or not something that is in your inventory should be included in your inventory. If you can't find it, is it really part of your inventory? That's the question that we're here to try to help you answer. So again, really important that you have all of this documented in your hospital's policy, in your facilities policy.
And something to bring up too, and one, first of all, does anyone find it interesting, like for hospitals that don't use Joint Commission? This is the Joint Commission language, so why is that? But these are the current standards, and if everyone's not familiar, they're going to be changing those sometime in 2026. We're not sure when. They're not published yet, but they're going to be taking the environment and care chapters and the life safety chapters out and replacing them with the physical environment chapters. So if you're familiar with DNV, you're probably familiar with the physical environment chapter in DNV, but these will all be changing and going away, but there's no published when that's going to take effect. It 25. They push it back to 2026, and if we're lucky, they'll push it back to 2027. So just keep your back to you.
All right, so ECO 20403 is that's our big standard that that you all need to be aware of and comfortable with, and maybe memorize. I don't know, maybe some of you have this memorized. What I want to dig into a little bit here is the risk level of your equipment. So we have high risk and we have non-high risk. We don't really need to get into the weeds, because if you really read what it says, it all requires 100% compliance or completion rate. So they seem to differentiate between the two, but really probably not a huge deal if you differentiate between the two. Again, your policy is what's going to be dictating all of this. So what Joint Commission really wants is, high risk equipment. They want to make sure that everything is documented and everything has 100% completion rate. So here again, we go to, if you can't find it, how are you going to complete it? Where it comes into where you really want to make sure that your asset inventory is accurate, and that everybody who is touching that equipment knows what has to happen with that. And if somebody finds a piece of equipment, that it makes sure to go through all of the compliance needs in order to be 100% completion. So your scheduled maintenance activities, and we'll refer to that a little bit here as ITM. I don't know if all of you are familiar with ITM as a word, as a phrase, but inspection, testing, and maintenance. A lot of you will call it preventative maintenance, so PMs. So just depends on your language. ITM seems to be the new buzz for that. So if you see us refer to ITM, that's what we're talking about. Also, if you have, how many of you have an AEM program within your facility? Okay, so rules are theory a little different because it calls it out, but are they really different? Not really. So you still have to have 100% completion. Again, policy, and that 100% completion is reached.
Yep. And if you just will be presenting also at New Orleans on the AEM program, so we're with our customers on a presentation for that. To New Orleans in June, which will
Anybody going? Yeah,
awesome.
We'll see you there.
So stop by and see us there.
This is for the non-high risk.
So
your inventory.
Why are they hitting that high?
Okay. Everything that is, somebody else is talking. I'm channeling some ghosts in here. Everything that you're inspecting is hitting that 100% completion rate regularly. So you just want to make sure that's all documented. So that's really all this to say. There's all this code language, but it comes down to the same thing. It really, you have a policy, you're following your policy, and you're hitting 100% completion rate. So I think.
So what does it? Highlighted some text in there. The first thing is, Jen called out whether to include in your inventory. As part of your initial inspection or as part of your ITM program, are there things you can do, when you're unable to locate? How are you marking that equipment as unable to locate? How are you, documenting all the changes you're making and the attempts to look for it? We're going to talk about those a little bit. So that's sort of, something it's not spelled out in the code language, but something you take advantage of the code language. And again, high risk versus non-high risk doesn't matter. Same thing with AEM. As long as you have your policies, as long as you say this is what we're doing, you have to be 100% compliant, but just have the steps needed to get out of the ones that you can't find or you can't form an ITM on. So when you look at your hospital's policy, it is your policy. So it is, they don't give you guidelines on writing it. There's probably a lot of people, this might be at where your level is at the hospital, might be a level above you of who defines that policy. But when you're writing the steps that you're going to take to go ahead and perform, or not perform and document, how many attempts are you looking at it? When do you take it out of service? So your inventory list, those are all the things you want to put in your policy. And you should know what that is. You should make sure you're adhering to it. Again, there's a lot of language in the code that says if it's part of your AEM program, it's a lot of hands for AEM, or part of your policy for how you're handling unable to locate equipment. Just make sure you're aware and your team's aware of what your policy states. So we put out a white paper about how to help you define that policy. It's a nice thing. I don't know where you can get that. We'll have to find out where
on our website.
It's on our. I think it's on our website somewhere. But part of it is defining in-service equipment. What does in-service mean? I've seen tons of different statuses of what people call in-service. Unable to locate. Maybe some sub-statuses. And then there's a certain number of how many unable to locate one, unable to locate two, so you could track how many times you look for that. I've seen people just leave them open as well. They have two statuses, active and inactive. It doesn't really give you visibility into performing some of those equipment. So, and when you're reporting on those, when you're reporting on your 100% completion rate, that status is going to help you determine to meet that 100%. You still have to document how many we're not able to locate. So that's part of it as well. But asset statuses are key, and we'll be talking about that as part of how do you work that into your day-to-day process. How does your team document that? I visited with some customers, and literally each technician had their own little small spiral notebook that had, this is what I look for, this is what these are the ones I need to look for next month, with just asset numbers written on a piece of paper. Anyone doing that now or has done that in the past? Oh, luckily it looks like everyone's past that state, but how are you documenting that? And is everybody documenting it the same way? Are you documenting through work orders? Are you documenting through asset status changes? Do you have a board somewhere where you're putting those things on? So, what is your source of truth for all of your work order and compliance information? And then how many attempts are required? Just a show of hands, how many look for, 2 or 3 times? Time mean, is that a cycle? Like if you can't find it, well, let's just say it's an annual and it's due in May, and then the month after it's May. And what are you doing? How are you looking for those? We'll talk about some strategies there as well. So, are you communicating with the departments where it's supposed to be? It's always where it's supposed to be, so it's easy to find. But are you doing those things as well? Are you emailing? Here's our list of missing equipment, or that's all documentation that we could talk about, and how we're doing those things as well. What you mark it as, inactive? That's what we talk about. Of looking for it. When you just say it's not here anymore. It has to be somewhere, but it's not. We're just. And then what if you find it? Ta-da! You find it. What's your process for putting it into service? Your retests. That's something that you want to document as well. That's probably the biggest thing. I was just at a session with the head of DNV on Tuesday, and he was talking about that number they get you on is you don't document the retest. So if you find it and put it back in service, have that documentation of that retest. And then that, how are you doing your compliance reporting to say, how are you just managing all this stuff? Is here's everything, here's all my numbers, here's my percentage of unable, but 20% were unable to locate. And he's like, okay, this can't be right. This is. So he's like, what are you doing? I looked, but he's like, they're like, I swear I didn't say that. But they look for the equipment. They were 20 or 30 pieces of for a survey. They found like your equipment moving around. It's like might be moving to different hospitals. Do a better term, but so how do you keep that up to date? If you make it part of your PM process, ITM process, this is where we say inspection, testing, and maintenance. It's just your PM process. What are your procedures and standard operating procedures around those things, and then some best practices that we've helped some customers implement as well. So here's a chart I put together around asset inventory life cycle. So like I said, you start with that brand new building, getting the asset inventories, scheduling all your equipment, very easy. Here's what we have today, put it all on a schedule, and you think you're done. Well, by now you're not done. Then you go to perform the ITM. So you have to find the equipment. That's your biggest challenge probably with all this equipment over. Everyone does department sweeps or just walking around looking for them, looking for the different colored tags, when those things are going to expire. You have your list of types of equipment or modalities you're looking for. If you're lucky and you find it, if it passes, you're good. But you can do a couple other things when you're finding it. You can evaluate the life of the equipment. If you're tracking conditions of equipment, you might say, hey, this is getting a little outdated. Maybe some things are beat up, so you change the condition. That could help with your justification of replacing that equipment. Just saying we managed equipment doesn't help you, but saying like, oh, these 58 items have significant damage. We think we need to replace them. That might help you with that. So it's not necessarily related to unable to locate, but just an important piece of your process. So when it comes time to justify the equipment, you're always doing that. So every year, if you're doing annuals, you can be assessing the condition of the equipment. We recommend that both on the biomed side and the facility side, just to continuously look at that condition, what might need to be. If it's broken, repair, replace. If it passes, you verify that it's there. There's also a little, it's really hard to see this arrow here. There's a little bit, if you reschedule it, you have a little bit of a circle going around with some of those items there. So the whole point is this is incomplete. It's not, you're never done. But if you build it into your PM process, you really help do those things. And when you're unable to locate, that's not represented here, then what do you do if you don't find it? So this is all based on if you do find that particular piece of equipment. So, as part of, we call it a feedback loop, but as part of your procedures, if you have the ability to capture, voltages and joules and all those things that you're capturing as you're testing the equipment, if it's there, you could obviously capture all that things. So that could be a question on your procedure list. Is the equipment here? Yes or no? So that could be something that maybe you don't perform the rest of those. If the equipment's not there, you have a process of, do you change the work order status to instead of just complete not found, and then do you change the asset status as well? So if that asset's not found, do any rescheduling of that equipment found? Do you need the equipment, or how do you document you're going to next month? I saw a lot of hands. How do you know you're going to look for it in June? What's telling you to go look for that in June? It's work order. And then everyone has I recommend tracking all work with work orders. It's the easiest way to know what you've done. If you start putting notes in the notes field in the asset or on the work order, looked in June, looked in July, and then you try to run a report on that, you can't run a report on that that's really reliable. So, but if you had 6 work orders of all the different times you look for it, that's a really easy report to deactivate that equipment, take it out of our inventory, so to speak. So how do you look for these things? Using technology, equipment might be located. Yes, stands for, and I can't read it. Have an art. I've heard that as a problem a while ago. I think that won't solve though.
It has to do with the way they set up the system.
Okay.
So all of the old Sutera sites will tell us which site it's at.
And we have some customers too who are using it just at their exits. So like if they know if it has left, they don't know where it is within the facility, but they know if it passed that gateway there. So
if you have a bunch of assets gathered up around the door. Anyone have it show up at a competitor's hospital? Yeah. Anyone get a piece of equipment from another hospital? Do you call them? And I'm just curious what people do. I didn't ask that in the last time, but or you keep it and just rebrand it. Initial inspection is it's on and it's working, therefore it passed the first test. But you need to have something in place that when that patient's taken off of that you get that equipment for the full test afterward. I did see some, so unable to perform, because it's, you obviously don't want to take it off the patient if it's keeping that patient alive. But you know where it is at least, and you could, update the location of that, update the location of the work order, and say this is used. Talk to the staff who will gladly let you know when it's off that patient, turn it into you, and bring it down to your office with a bow on it. No, but you can do your best, but like I said, document all those things, who you talk to and who you sent that email to say, hey, when this is done, do these things. Go ahead. Mm-hmm.
Best practice for that to have to go all 100 work orders and say we send this to the nursing manager of these 100
Yeah, depending on your system, sometimes there's easier ways to attach a document to multiple work orders. If you have an email, make a PDF of that email and attach it to the work order.
Or if you have a way to mass edit those in some way to put a note in to say, these are the ones that
yeah.
with this person, so they all get that note.
Okay. We can, yeah, that's a common thing to add a note, you know, a labor charge, a note. So those are things
Come see us in the expo.
we can even attach that. If you have one email, you could attach it to 100 assets, 200 assets as well. So, so there, like I said, it depends on the capabilities of your system. But like I said, I recommend, you know, work orders are the ultimate. Like I did something, there's a work order, a work ticket, a service request, whatever you want to call it, you know, with different statuses and different categories, that really help you manage that process. So.
And hopefully it's attached to your asset as some kind of a history that you can show easily when, you know, you have an inspector on site and they want to see this asset, you can pull up, look, this is how many times, this is how many work with. So
yeah, so if you're looking at your unable to locate documentation, or you have your 23% of your hopefully not. Look, you know, they say, show me this one asset number, what you did. If you could pull that asset number up and show them, here's our process, here's all, dating a lot of them, but you know, if you're looking for 100 pieces of it, you're not looking like and then go around the hospital notes. Nope, didn't find that one. And then you're going to look for the next piece. It's not how you're doing it. You're walking around, just look for, I can't read that one.
retire if number of
Yeah, retire if an attempt. So if you're over the next 3 months, over the next 2 cycles, for a 2-year PM, I would say, you know, not wait 2 years to look for. That's a really long time to go without having that. I'm not sure if you might get dinged on that one. And even if it's in your policy, they'll be like, you can't do that. So you could make a policy like, I will do all my equipment, you know, at this time. So your AEM program probably is not going to let you do something along those lines. If it's you're following manufacturer recommendations, which for, you know, some equipment you have to do it in those. You can't have an AEM around on that. But if you can justify your AEM policy of having a 2-year or 3-year cycle, for inspections, great, but you have to have the data to back that up. So you should be doing all this stuff anyway. And then the next, you know, what are you doing to look for it? Are you taking those unable to locate out of that, so you're hitting that 100% mark? But are you also documenting? And like I said, include that number to locate as well. So. Document it. You could put it back into service. Again, the number one, documenting your retests. So. Everyone here documenting the retests? Nobody? Sometimes, but that's an important one for that. And it could be as simple as just regenerating that, you know, the preventive work order has the test on it, just maybe regenerating that again, or duplicating the PM and changing the category of it, again, based on the capability of your system. But that should have that procedure on it for the retest and where you're capturing. How many are using testing equipment like Fluke or one of those? So Prong or one of those ones out there. You know, it's something you should be retesting anyway. That's part of the, you know, when you're finding it, you're doing it anyway, because part of you looking for it is to perform the PM. So make sure you document that one.
And don't forget to document your testing equipment, your testing of your testing equipment too. Make sure
it's a very important point. Yeah, If you have to calibrate that equipment, make sure it's calibrated regularly as well. So that's another thing. It wasn't a top finding, but it's another one to do. And that's true even if you're finding it and it fails. Like if you're performing the PM and it fails, and then you fix it, you do need to document that retest. So it's almost doing 2 PMs on it. So think of it that way. Just do the PM again and document it after you repair it, especially if you send it out to a vendor. So, don't just get it back from the vendor and in the service, do your retests. So.
All right.
So this is I told you it was coming. So unable to perform.